So the first one is in Hollywood, Florida, which is just north of Fort Lauderdale, Florida. And this is a local community-based chapter made up of heart patients and caregivers and families. And we partner with the regional hospital there, Memorial Regional Cardiac and Vascular Services. And our members are, the patients and the caregivers are trained. We don't give medical advice, but we provide that peer support. And in partnering with the hospital, there's a 2-hour weekly hospital discharge class, and it covers a variety of topics that really help the patients and the caregivers know how to deal with their journey of their heart disease. And part of that includes, what medications to take, make sure you listen to your doctor, you're following the prescriptions according to your physicians and your healthcare professionals. These discharge classes not only include the peer supporter, but they also have pharmacists, nutritionists, and other healthcare professionals involved in that regular class. So as we partner with the hospital, we've found that this has really helped improve their readmission rates, as Andrea mentioned, that they are lower than the national average for readmission rates there at Memorial Regional. Part of our peer support program brings these patients and caregivers together monthly in social gatherings. The peer supporters are also following up with those patients after discharge from the hospital to find out how they're doing, make suggestions and talking and inviting them to the social gathering or the monthly meeting where we have educational programs. Healthcare providers are providing topics of interest, many of those mentioned. And in partnering too, we really work and get the word out to other patients and families about the activities, sharing patient stories. And so there's that common connection with the patients and their families. And this Hollywood, Florida is in Broward County, so it's an underserved population where the hospital and the peer supporters together are helping the patients. Let's see, the second case study that we really wanted to go through is in Gastonia, North Carolina. And there we have approximately 100 patients and caregiver members, and 60% of those are peer supporters. So they're trained to be peer supporters and knowing listening skills, communication skills, and so on. We partner there in Gastonia with Caramont Healthcare in providing support to patients. There's a number of hospital in-kind services that are provided. And in this case, this chapter was formed about 3 years ago. And the hospital cardiac rehab department actually reached out to Mended Hearts because they wanted to form a peer support group there at the hospital and partner with Mended Hearts. And so they sought us out, and the group was formed about 3 years ago. And it continues to have monthly meetings and programs, and the hospital really feels that there's critical success in having the patient education and support. So they're very supportive of the patients there in partnering together for support. I wanted to tell you a story about one of our patient members who, after diagnosed with mitral valve, open heart surgery, was on a number of medications, and I think it was a blood pressure medications that she was invited after being visited in the hospital by a peer supporter to come to a monthly gathering of the Mended Hearts group. And in doing so, she shared her story and indicated she was on a particular blood pressure medicine, and she found out that there were probably 3 or 4 other patients in the room that were also on this medication. Well, she was taking her medication in the morning and had some side effects. And so she found out that some of the others were taking it in the evening. And so she talked to her doctor about that, and he said, there's no problem about when you take it, so try it at night. And so she really felt that support and information that she received from her peers, her fellow patients, really helped her, adhere to that medication and stay on it and so on. Mended Hearts, these are all volunteers, patients that really partner with the hospital, and it helps the hospitals in their joint commission, their patient satisfaction ratings, and so on, when you have a patient peer supporter visiting another patient to listen and share a similar experience. So I think, the sky's the limit. We really want to encourage patients to advocate for their own health care, access to medications, et cetera, and sharing experiences with fellow peers, patients, and family members really does improve outcomes. And so I really feel that peer support is a powerful tool. And if you are interested in, learning more about Mended Hearts, want to form a local chapter, here's our contact information. So thank you for this opportunity.